Well, welcome everybody. Thank you for joining us today on our public policy town hall. Now that it is December, we've had time to see the final results of the presidential election and state elections, and wow, it feels like actually 15 years ago when we had election day. I think that's the nature of 2020 though. So thank you for joining us. I am Erica Terry, CEO and Executive Director of Susan G. Komen, Kansas and Western Missouri, and I am so lucky to have those of you on today join us for a really incredible discussion. We'll talk, broadly speaking, implications of the election for federal priority issues, as well as Kansas and Missouri, and which will guide the conversation and the work that we do in 2021 when the next legislative session starts. So I will go ahead and call on each of you to introduce yourself, where you work, and why public policy is so important. I'm going to start with our distinguished guest, Molly Guthrie.
Thanks, Erica. I'm Molly Guthrie. I'm the Director of Public Policy and Advocacy for Susan G. Komen. So I oversee all of Komen's policy work, whether that be in Washington, D.C. or states across the country. And I have the privilege to be Komen headquarters representative for state policy work, both in Kansas and Missouri. As a Kansan by birth, something that holds a big place in my heart. So I'm very happy to be here today and be joined with such experts and have this conversation.
Thanks, Molly. We will keep it in the family. Peggy Johnson.
Thank you. I'm Peggy Johnson. Today I'm the wavy Peggy Johnson for some reason, so I apologize if you get airsick watching me or something. I'm Executive Director of Wichita Medical Research and Education Foundation in Wichita. I'm a longtime public policy wonk, I would say. And I'm a longtime public policy advocate for Susan G. Komen. Also I have been on the Kansas Cancer Partnership since its inception about 20 years ago. And public policy has just always been where my heart is. That along with cancer research funding. Thanks.
And you're a survivor.
And I am an 8-year survivor of triple negative breast cancer. Yes, I am.
Thank you, Peggy. April.
Well, my face lit up, not because you're a survivor of triple negative breast cancer about 8 years ago, but because I am as well. So we have that in common, even the same time frame, it sounds like. So very happy to connect with a fellow survivor. My name is April Holman. I am the executive of the Alliance for Healthy Kansas. We are a coalition of about 120 organizations and counting, working towards achieving Medicaid expansion in Kansas. We have a large grassroots network, as well as that kind of grass tops coalition. And even though we have been working on this for quite a while, some of our members have been working on it even longer. So we are very committed and dedicated to making sure that the upcoming year is the year that we Medicaid expansion in our state.
Thank you, April. Katie.
Good morning. I'm Katie Manga. I'm the CEO at Gateway to Hope. We're a nonprofit organization based in St. Louis, so across the state of Missouri from many of you. But we serve women who are across the state of Missouri and actually across the river, even into Southern Illinois. We serve women who have breast cancer and who are struggling financially during their treatment. But we also serve women who are seeking out screenings and helping to navigate women to those screenings, which of course we know are so important. So we're pretty active in working together with the state programs and hopefully with Medicaid expansion programs, which I know we're going to talk about more today. So I do actually have a background in public policy. So I love this topic and I don't get to talk about it every single day. So I'm excited to be here and talk about how things are going in Missouri.
Thank you, Katie. Well, thank you all so much for, again, being a part of this discussion, important discussion. It's nice to take some time to just reflect on the election results and really observe and see, how best do we tackle some of the issues that are most important to us. I have a kitten that's joining me for our discussion, so I apologize for that. So let's just dive in and talk big picture first from a federal policy perspective. Molly, I'll turn it to you. Can you talk a little bit about, the political landscape as it relates to the progress we need to make for on the priority issues that Komen has advocated for breast cancer? Have things changed? Are we in a better position? Do we need to work harder? If you could just kind of go over that, that would be fantastic.
Absolutely. So we're still waiting a really important outcome at the federal level to determine which party has control of the Senate, which will have a big impact on really what type and how many policies we actually see move in Washington, D.C. Over the next 2 years. Kind of contrary to what a lot of the pollsters and the people that live and breathe elections thought would happen in the 2020 election, that there would be a wide shift and more Democratic members in the Senate and a bigger margin in the House, did not come to fruition. So the House, the Democrats actually have lost some seats. There's still several that are pending, but the majority, the number has gone down significantly. And in the Senate, as all of us are probably well aware now, Democrats have 46 seats. There are 2 independents which caucus with the Democrats, which brings it up to 48. And then the Republicans have 48 seats as well, with 2 runoff elections pending in Georgia. That would either bring it equally 50-50, with Vice President-elect Harris being the tying vote breaker, or will maintain the majority for the Republicans in the Senate. So all of that to say, when you look at Congress, with the breakdown of the parties between both the House and the Senate, I don't know that we're going to see extreme change on either side. Really, to see movement, I think we're going to have to be very in the middle when it comes to policy beliefs, both from the Republican and the Democratic side. I think it potentially can bode well, especially for the breast cancer policies or the access policies that we work on at Komen, because they really are bipartisan issues. And when there is such a need for change to our healthcare system, these are issues that have agreement on both sides of the aisle and could show progress. So I'm cautiously optimistic. However, it takes a long time to get anything done in Washington, D.C. So I will be hopeful that we'll see a lot of movement on our key priorities in Congress. On the administrative side of things, with President-elect Biden, he has long been a champion of addressing cancer. He, under President Obama's leadership, was brought in to really secure the cancer moonshot, which was a huge move forward for cancer, and has close connections to the disease, unfortunately, through his family. So I think we will have a really great champion in the White House. But his ability to implement or change policy, again, is going to be dependent on what happens with the congressional elections. So I would say I'm optimistic, but cautiously optimistic. The other thing that I would plug is that it's easy to start thinking about January, but Congress still has a lot to get done before the end of this year. So we are in a continuing resolution for the federal budget that expires at the end of next week. And so action is required there. We're still waiting on the next COVID package. And this was a package that was supposed to address a lot of the issues that patients are facing. And we've been waiting on it for months now. So that's there. And then there are several other pieces of legislation that we feel are very important to patients that we would love to see movement on before the end of the year. So I would just, while it's important to think about 2021, there's also a lot that Congress needs to get done before the end of this year. And I would just highly recommend that everyone out there continue to reach out to their elected officials and remind them that there are things that they need to check off the list before they adjourn this session.
And they can do that through the Komen Public Policy Institute, correct?
Yes, absolutely. Let me pull up we have a text code. Let me pull it up if you want to move to another question, and I'll share it towards the end.
Perfect. I think one of the things that I was so excited about is just listening to President-elect Biden's speech the night of the next day. He said the word cancer in his speech, and that's not often that an elected official targets a specific disease that specifically with cancer. It's just refreshing that is top of mind for the next administration, and hopefully that bodes well pending how the Georgia runoff goes.
I would also be remiss to not share that Vice President-elect Harris, her mother, before her passing, was actually a breast cancer researcher.
Oh, wow.
So she also has a very direct tie. She's been a long time advocate for cancer legislation, but her mom was a breast cancer researcher by practice. So again, a nice tie-in to the work that we do.
Fantastic. And this question is open to everybody. If anybody else wants to chime in on the federal side, I wonder if you wouldn't mind, Molly, sorry to put you on the spot again, and this isn't even in the list of questions, which is very typical for me in these discussions, but could you talk a little bit about the Affordable Care Act and the implications, because there's so much coverage of this in the news. We're in the middle of a pandemic, people are losing their jobs, losing their employer benefit, and what do we need to do as a community to either protect that while the current administration is in office?
Yes. So again, it seems like there's a lot of moving parts happening right now. And I live in a time warp. So maybe 2 weeks ago, I think, the Supreme Court heard arguments on what is now referred to as Texas v. California. And so the premise of this is that because the individual mandate was struck, that means that the entire ACA in its entirety should be struck down. And lots of legal terms, which I am not an attorney, but things to do with severability and other important issues, obviously, which is why it's gotten to the Supreme Court, that were not able to be solved by lower courts. So the oral arguments were heard a couple of weeks ago. A decision on those arguments typically would come in June, but there have been some conversations that it might be fast-tracked and come before then. But again, knock on wood, but the general consensus based on the questions that some of the justices ask were that the likelihood of the entire Affordable Care Act being thrown out is slim. Again, you never know until the actual decision comes out, but the impact is significant. If that were to happen, a lot of the things that people don't remember from a decade ago, not even being able to get insurance because of pre-existing conditions, which cancer fits into. Obviously, with what we're going through right now, COVID would be a pre-existing condition that would allow insurers to just not issue you insurance or have very high out-of-pocket costs that are associated with it. Additionally, the insurance that we have come to know now has out-of-pocket caps. It doesn't have lifetime caps, so you don't just get cut off. When I first started with Komen was when the Affordable Care Act was being debated, and we had stories come in, day after day of women that were making the decision either to stop with treatment or go into bankruptcy. And that's a reality that people were facing, and unfortunately some are still facing today. But the Affordable Care Act did a lot to negate some of the bad policies that were out there impacting patients. Back to my earlier point, unfortunately, a lot rests on what happens in Georgia. There's been conversations about what can happen. The Senate and Congress can pass legislation to hold up the ACA, to maintain some of those provisions, but a lot of it is a big question mark right now. But even if the ACA were to stay in place, there are still significant areas of opportunity. There are a lot of barriers that breast cancer patients still face, but I think ties in nicely to what's happening in Kansas. The ACA allowed for expansion of Medicaid, and that's something that we continue to advocate for in Kansas, and something that states should continue to take advantage of when we're talking about ensuring that the people in our community have access to the care that they need.
Absolutely. Anybody else have any thoughts? Yeah, go ahead, Peggy.
I have a question for Molly. If it gets to 50-50, or even if the Senate gets to like 51-49, there used to be some senators that we could rely on that would cross the line and vote for some measures. Senator Moran used to. Hopefully we can count on him again. And the one in Maine,
Collins, Susan Collins.
Yes, Susan Collins. We've seen her get a little more conservative in the last year or so, but do we think that there's anyone that when it comes to the Affordable Care Act would cross the aisle and possibly vote with the Democrats just to secure like something like the Affordable Care Act? I just don't know the political landscape that well.
Yeah, I think it would depend on what said package is.
Right.
When there were a lot of attempts around repeal and replace, and other efforts around significant changes to the ACA, there were a fair number of Republicans on different steps of the process that were not in favor of those efforts. But again, I mean, some of these, a lot of the things in the ACA are things that everyone likes. So kids being able to stay on their insurance until they're 20, on their parents' insurance until they're 26, not having discrimination because of pre-existing conditions because of cancer, preventative services like access to screening mammography for everyone. There are these ideas that people like, and so that you'll often hear both sides of the aisle speak to. I think the difficulty is you can't have just the good stuff, right? Like there has to be a balance, and that's how we got to the Affordable Care Act, right? There have to be pay-fors in there. So I think it unfortunately is a big question mark. And again, going back to the election, there were thoughts that there would be blowback on some of those members that did cross the aisle or didn't cross the aisle on some of these Affordable Care Act pieces of legislation, and that didn't happen. It didn't come to fruition. Those same people are still in office, but that might mean that they would support future efforts. I need to invest in a better crystal ball because I'm not sure what to expect.
I'll invest with you. Let's switch our conversation, unless anyone has anything else to add on the federal piece, to what's probably even more important, which is local, right? The great Tip O'Neill said all politics is local, and we've got some really important things that have happened in Kansas and in Missouri. We get to celebrate that Medicaid expansion was voted on in August on the ballot and by Missourians, and so that's a huge victory. Kansas, not so much. We've got a different makeup of how this effort can come to fruition through our elected officials, which speaks to how important it is to make sure you understand who you're voting for on the local level. I want to start off with targeting you, April, if you don't mind. The Kansas legislature and the elections, just kind of broadly speaking, how did the election pan out for Medicaid expansion in the state of Kansas?
Well, it didn't go well. And I'd like to clarify, I don't think that that was any sort of referendum on Medicaid expansion. It just so happens that supporters of Medicaid expansion also were supporters of a number of policies that tended to be a little controversial, but were very much needed for the well-being overall of the state. One of those things that comes to mind is in tax policy. Some of the people who had been Medicaid expansion supporters and very steadfast in that also were supporters of kind of undoing the Brownback tax experiment, and that was very much needed for the long-term benefit of the state and important programs that the state supports, but it was unpopular for a number of reasons. So even though it was not a referendum Medicaid expansion, I think that it will have an impact on expansion. So we really did not see a huge net difference side. So a lot of supporters, we gained some supporters, and there are still some who are supported expansion at some level, but not able to support it right now. Where we see a change is on the House side. We had been in a situation in the House where there was a very clear majority of members that supported expansion. As we began vote counting after the election, we think that we fall short of a majority at this point and would probably need to flip somewhere around votes in order to get where we need to be. That would give us just a little bit of cushion. We'd like to see maybe even more cushion, especially this year where we don't know at any given day or any given vote if all of the members will be present because of COVID. And so I think we would feel a lot better if we had more of a padding. So basically, I think that we have our work cut out for us, but as I remind the people that I work with most closely, we did not have a majority of legislators that supported Medicaid expansion when we started this work. And it's really through education and gaining that understanding of why this is so desperately needed across the state, and particularly in rural communities, that we were able to get to that point. And I truly believe that we can get back to it with the legislators that we have this year as well, this upcoming year.
Fantastic. I know it's been a long haul, an awful, awful long haul. 7, 8 years, 9 years?
Well, the first year that expansion could have been put in place was 2014. So the Alliance for Healthy Kansas wasn't created until 2016, but we have partners who have been working this for the entire time, since the beginning of the Affordable Care Act 10 years ago.
Incredible. And, I was recently reading a book that said, typically initiatives don't pass unless they kind of fall into 2 categories. 1, somebody gains economically, or 2, it will help the security of our nation. So the notion of, inflicting $7 billion into our economy during a pandemic, and we know there will be a budget shortfall in January. It's hard to justify why that reasoning hasn't taken off. I don't know. Do you have any insight?
Oh, I have lots of insights about that. The bottom line is the issue of Medicaid expansion has gotten really tied up in political battles. And instead of looking at the opportunity that we have to address many problems that the state faces. Lawmakers have gotten stuck in that political conversation. So I think it's our job as the Alliance and, our partners to really get back to the nuts and bolts of why, practically speaking, expansion is what we need to do. And it's going to help in a lot of different ways. It's going to help our economy. It's going to help businesses to have healthier employees and more people who are ready to kind of drive that rebound of the economy that we, desperately need. It's going to help our healthcare providers, hospitals, and particularly in rural areas where they have been really just teetering on instability for those hospitals and really the whole healthcare infrastructure for many years. So yes, I think that what we need to do is absolutely bring this conversation back to the nuts, bolts, and practicalities that Kansans really care about the most.
I imagine there's a place for it to fit in also in the kind of state preparedness for another pandemic, or kind of that emergency preparedness, right? Because I'm sure everybody will kind of shift their conversations once we get a vaccine and it's widely distributed. How are you prepared as a state, as a community, for something like this to happen again? And expansion clearly fits within that. As a state. So it seems like that could obviously fit into the line of thought of being a part of the solution to prevent something, not really prevention, but be a part of that for the future, having our state prepared for it at least. In
Absolutely.
Our system, right?
Mm-hmm.
So-
Absolutely.
So April, I have a question for you because obviously our state and our hospitals and even our healthcare workers would be in better shape today
Mm-hmm.
if we had passed Medicaid expansion a year to 6 years ago. They would have been in a better position to have addressed COVID because we would have some of those rural hospitals back. And I'm wondering if there's a case, and I'm sure you're so smart about Medicaid expansion and getting the word out to people, but I wonder if there's a case to be made to say, if we'd had Medicaid expansion, this is how we could have addressed COVID versus the way that we are addressing it now. Because just because we know kind of the dynamics of who's being diagnosed with COVID, that many of them probably don't have health insurance. So the hospitals who are still open and taking these patients they're going to have tremendous outlay of expenses because they're covering people who don't have health insurance or don't have adequate health insurance. So is there a case to be made to say to Kansas, look, this is what should have happened? We know all of the hospital administrators have been on our side when it comes to Medicaid expansion since the beginning. But I'm just wondering about how we tell the public that the look of Kansas could have been different.
I think that's really an important point. And one of the ways that we are able to do that is looking to our neighbors who have already expanded. So Kansas, there are 38 states have already expanded. A couple of those are our neighbors who haven't gotten all the way up and quite yet. But even looking at, 36 states have had a little bit of time to work on that, we can see how played out a little bit differently for them, as opposed to the way that we had to address things in our state. So there are very few benefits for being one of the last states to expand, but I think one of those benefits is that we really are able to hold out concrete examples from other states who are much better positioned, not only to handle crises like the pandemic, but also on a daily basis, they are able to provide more stability, better, less uncompensated care, and more coverage for people in need. So yes, I think that is a really important point for us to be emphasizing now.
Thanks.
And I think one of the things that I think is interesting that, I think a lot about the work that we're doing and how do you frame the importance of the work that we are doing related to the fight against breast cancer in light of the national dialogue, right? The focus is on COVID. We're in a global pandemic right now. And I was in a meeting a couple of weeks ago with a very smart Dr. Josh Holman, and he said, beating COVID is part of the strategy to beating cancer, because the sooner we can get this under control, people will start going back and getting their screenings. And if we don't do that, whether it's for colorectal or breast or whatever, we're in for a world of hurt and essentially creating another pandemic that no one's really talking about. We've heard from the National Cancer Institute director warning us that, if people don't start getting their screenings, we'll have upwards of 10,000 more breast and colorectal cancer deaths over the next decade than would have been expected had COVID not happened. So I think you're right, Peggy. It seems like framing the conversation around, future things that we're kind of putting a Band-Aid on something or working on something only to create another problem by not achieving some of this stuff is probably worthwhile. Any thoughts from you all? Katie, were you going to say something?
Yeah, I think everything that April is saying is interesting, because we've seen that play out in states like Missouri, where we've been able to focus on the issue itself and the benefits of expansion and try to block out the political noise. And actually, I think that's why a ballot initiative was successful in Missouri. Mm-hmm. I also think, to Peggy's point about COVID, the fact that it was on the ballot in August of this year, right in the middle of the pandemic, a campaign was able to successfully make the case for why things could have been different and why things can be different in the future. And, I think obviously the next step in Missouri is now implementation. And how is that going to play out in the legislature beginning in January when they go through budgets? But I do think there's this sense of, things probably could have been different if we had expanded this. And that doesn't mean that Medicaid doesn't need some reforms. And so what we might be looking at here is both a funding strategy and a reform strategy kind of working in tandem. But either way, we're still going to be in a better place because of expansion. And I think, April, to your point, you never want to be last, but at the same time, there's a lot we can learn from other states, both in the political approach, but then also in the implementation approach as well.
Mm-hmm. And this isn't directly, it's kind of tangentially related to Medicaid expansion, but touches on, I think, all the topics that have just been covered, and tying it back to screening. So when you look at COVID and the incident rates and the mortality rates and talking about the populations where it's hitting, I think those of us that have been in the healthcare field and the policy field for a while, there's not a lot of surprise there. There's a lot of similarities actually between COVID incidence rates and population when you look at breast cancer. So for COVID, for example, the Black community had about a 40% higher chance of contracting COVID and dying of COVID compared to their white counterparts. And if you look at breast cancer, those are very on par. There are gaps in our system that have existed for a long time that COVID brought to light and brought to the attention to a lot more people, and hopefully that can translate, as Katie was saying, to changes in understanding of why Medicaid expansion matters, but why there are these gaps in care and gaps in outcome, because there really are systemic issues, and Medicaid expansion is one way to try to expand access and equal the playing field for people that just does not exist right now.
Mm-hmm.
I do think one of the things that COVID has done is it has shined a brighter light on health equity. And I know everybody on this call, health equity is a huge thing for them. But I do think that COVID has done that. It has shined a light on health equity, and that drips down to cancer because we know there are big gaps when it comes to diagnosis and treating all cancers when it comes to health equity. So I'm sorry we have COVID, but the other thing is COVID has narrowed the beam on what we have to be doing and how we have to be approaching those that don't have service, those that are going to need service, and how we bring them into the fold, whether through its Medicaid expansion, which we all believe could certainly help. But it has shined a light that there are gaps, and everyone on this call today recognizes those gaps, and maybe now we're going to get somebody's attention about where the gaps are and how we have to be helping them.
Mhm. We often talk about how there's no way possible we will ever achieve our mission to end breast cancer forever without focusing on health equity. It's hand in hand, and we're doing a disservice actually to all of our donors and all the people that are supporting us if we don't focus on health equity, because that's part of the equation to achieve the mission. And not to mention, it's the right thing to do. Yeah, what the general public now is discovering is what I'm guessing public health has always known: the inequities in our health systems, our economics, our education, so on and so forth. And I'm, as you said, Peggy, I'm thankful for the heightened focus. I'm sad that so many lives have been lost to this, but I'm thankful for the heightened focus, because perhaps the conversation can be steered towards public policy initiatives that can actually make some systemic change. And we know, the great Daniel Dawes talks often about, we focus a lot on social determinants of health, but quite frankly, there's a lot of instigators for those social determinants of health, which are all public policy related. That's why talks like this are so important, and why it's important to engage our community as advocates for these important issues. It really matters. And someday we are going to pass Medicaid expansion in Kansas, and we can thank all of the community for supporting and being a part of the initiative. Let's just talk really quickly about Missouri. Katie, what are some of the next steps in terms of implementation, and what do you kind of have planned for work to be done on the ground?
Sure. So, first of all, the funding issue period has to be addressed, and that'll happen through the typical budget process. The governor will release his budget priorities. The legislature will take those up and address them. So I think, step one is just really paying attention to how that looks. One of the things that we're really looking out for is how Medicaid expansion is funded, implemented. And I think those are maybe two different things. Funded is one thing, implementation then is kind of how the sausage is made, and what are the reforms that are done to the program, to Medicaid itself, in order to help pay for this. And then third of all, really paying attention to those existing programs that really are Medicaid expansion that benefit women who have breast and cervical cancer. So the BCCT program is basically Medicaid expansion up to 250% of the poverty rate. The Medicaid ballot initiative here in Missouri will only provide coverage for people who are up to 138% of the poverty rate and below. So if, for example, the state decides to use some general revenue funding that is currently funding that BCCT program to fund Medicaid expansion, what we could be looking at is a net loss in coverage for women in the state of Missouri. So that is something we're really paying attention to, making sure we can preserve those existing programs while supporting the funding of Medicaid expansion and its implementation. And the same goes for the Show Me Healthy Women program, which is the screening, our version of the screening program, similar to what all the other states have as well. So we want to make sure that we preserve that funding, and we're really going to be watching for that when the governor puts out his priorities to make sure that stays there in the budget. So, as far as our priorities and what we're watching for, those are all of the things, making sure that Medicaid expansion isn't done at the expense of some existing programs that, yes, they do have their problems, but they at least exist and provide coverage at a higher to more people than Medicaid expansion will.
Mhm. That's fantastic. So we talked about a lot of really meaty issues and had a really fantastic conversation about our local legislatures, federal policy, and ways we can be engaged. I'd like to ask each of you as we wrap up, I'll call upon each of you to say one thing you would like people to do in support of the stuff that we're talking about. How can we activate them in a meaningful way to make their voice heard and be a part of the civic process as advocates of cancer, advocates for breast, and then just health advocates in general. Molly, let's start with you.
I think the top thing people can do is use your voice. You have to remember that these people, they were elected and they work for you. And the more you share your voice, the more they understand what the needs of their community are. And so I think people forget about that. There's been a lot of noise in the news, but at the root of what I do in policy is to implement policies that impact human beings. And oftentimes lawmakers need to understand that it's not just words on a page, or it's not just a piece of legislation. The impact truly is on human life. So I would encourage people to contact their members. As I mentioned earlier, and Erica, you mentioned as well, at Komen, through our policy, our Center for Public Policy, we have a really easy system to stay involved, and it will keep you updated when there's opportunities to engage both in Washington, D.C., but as we engage on Medicaid expansion in Kansas and the treatment program and the screening program in Missouri, you automatically get notified, and it's very easy. And so I would encourage everyone to sign up to be an advocate. And it's simple. You just have to text Komen, Komen, to 40649. Again, Komen, Komen, to 40649. And that gets you into the system. And then all you have to do, literally all you have to do, is click a button, and your elected officials know where you stand on these issues. So again, know how much power you have in your individual voice and how much it matters. Thank you.
Katie.
All of those things, absolutely. And I think, something that we've recognized in Missouri is that there's not a whole lot of organization around advocacy for policies that are going to support expansion of access to women who have breast health issues, whether that's breast cancer or otherwise. And so we are going to be doing some of that organizing. And so I would just ask that everybody do all of the things that Molly said. And then if you do live in Missouri and you're really interested in being involved, to just stay in touch with Gateway to Hope, because we're going to be putting out some more locally based opportunities for folks to be involved. So we look forward to building a coalition of community members who are really passionate about these issues.
Wonderful. April.
I think I would piggyback on the lifting your voice. I think that it's really important for everyone to know their elected officials at the Kansas State House. So introduce yourself, make sure that they know who you are, make sure that they know what issues are important to you, and don't take no for an answer. A lot of times people push back, like, we can't afford to do that. Yes, I'm with you. That's really important. but we can't do it there. Keep pushing. That's not an answer. There's always a way. If there's a will, there's a way, and that applies to the legislative process as well. So be persistent and make sure they know who you are in a good way. I mean, it's important. You do catch more flies with honey than vinegar, but in a very firm way.
Thank you. And finally, Peggy.
Thanks. I would just say everything that Katie said and everything that Molly said, everything that April said. Katie really put the situation, I think, that we're going to have to look at in this next legislative year, because we do have state money in the budget for the breast and cervical program that Komen actually went up and argued for, and we have a line item. And through a couple of governors ago, we lost some of that money. It was $230,000. It's down to about $203,000, I think I think the important thing this next year is, number one, that we protect that line item, because it does provide services for people that are kind of on the outsides of EDW. And then how we do exactly what Katie said. How are we going to protect that funding along with get Medicaid expansion? Because I've been looking at Medicaid expansion for 2014 or 2006, whenever it was a long time ago. We've been trying really hard to get this passed, and we can't let up on it. I know April and her organization aren't going to let us, which is great. I would love if we could get it on the ballot like Missouri did, because I think it would pass. But we've got what we've got, and so we have to look at it in two pieces. We've got to protect the funding, exactly like Katie said, for our breast and cervical program, but then figure out how we're also going to fund Medicaid expansion in an organized and way that's going to protect everybody. And Erica, thanks for this opportunity. This was a good conversation today.
I really appreciate all of you taking time to be a part of it and lending your expertise. I have thoroughly enjoyed working with each of you one-on-one, and am very supportive of any organization that will end cancer, and specifically breast cancer. And unfortunately, it's too big of an issue for any one of us to do by ourselves. And so the power in collaborating and partnering cannot be underscored. So thank you for your partnership and friendship throughout all of this, because we need friends during this now more than ever. So thank you so much for joining us today, to all of our speakers. And we will put links and access to the resources for the Alliance for a Healthy Kansas, Gateway to Hope, Komen, Nationals Center for Public Policy, and please get involved and take action. It's more important than ever. Your life is literally dependent on it. So please take action. So thank you so much, everyone.